I'm Dr. Gary Kaye, and this educational video is going to show you how easy CAD CAM technology can be. We are using Henry Schein's E4D dentist system to achieve this. We'll be replacing two restorations on our patient Maria, tooth 18 and 19. This is technology that we use every day in our office in New York City, and I hope it'll be helpful to you. Enjoy. We do everything the way we usually do. Make sure the patient is nice and numb, taking our time to give a slow lower block. We're replacing these two old amalgams that have some marginal decay. Everything is done the way we normally would do. We pay attention to the guidelines for all ceramic restorations where there's sufficient thickness of the material and no sharp line angles. We make sure that all the caries is removed, and at that point decide whether we're going to turn what we had planned an inlay into an onlay, or in sometimes full coverage. In this case we're going to shoe the buccal cusp, making sure we follow the preparation guidelines. These margins ended up subgingival, and our patient is on Coumadin, so isolation is very important. We use the laser. It gets us most of the way, and then we'll pack some cord and really isolate those margins very nicely. Ideally, we'd like supragingival margins, but that's not always possible. So when the margins are subgingival, it's important that we can define them, isolate them, so that we can scan them, and more importantly, be able to achieve isolation at the margin for bonding. We're now ready to take our virtual impression. The amazing thing about the E4D unit is that we can scan the teeth without the use of powder, and we're able to generate a true three-dimensional representation of the preparation and teeth, which will allow us to design very accurate restorations. E4D has made designing of the restorations very easy, but the best part of CAD CAM dentistry is you get to control all aspects of the restoration. Rather than telling the lab what you want them to do, you get to do it yourself in-house. The training that comes with this machine makes it very easy for any dentist to offer same-day restorations to their patients. We are using the Emax block from Ivoclar in this case. We select the shade and appropriate block size. Simply insert it in the mill, and in roughly 10 to 15 minutes we have a restoration we can try in. While the restoration is being milled, I'll use my time productively by checking hygiene patients or seeing an emergency. So with the milling complete, we're able to inspect the restoration. We remove the sprue and we try it in the blue phase, which is much softer than our final form of the Emax. This way we can inspect the margins, contacts and occlusions and make any adjustments as necessary. The amazing thing about the E4D is that it's very rare that you have to make any adjustments. We have placed thousands of these restorations over the years, and I'm always impressed by the accuracy and precision. Once satisfied, we go ahead and stain and glaze. All we need to do is add some characterization to the restoration and spray on some glaze and place it in the oven. which is automated and easy to use. When they come out of the oven, we have lifelike translucent restorations that are ready to insert, and really beautiful. For all ceramic restorations, I like to use Ivoclar's multi-link system under a rubber dam whenever possible. We etch the restoration and silinate it prior to adhesion. We like to place the adhesive directly onto the tooth, which makes the cementation process easy and consistent. The excess is cleaned up. Then we light cure to ensure complete polymerization of the material. The final cleanup is done under the rubber dam and then it's removed. CAD CAM technology, and E4D in particular, has allowed us to achieve an incredible result in just about 2 hours. It's great dentistry. It's wonderful for practice efficiency and productivity. But most importantly, patients are thrilled.